The human body rarely shouts. It prefers to whisper, to nudge gently, hoping we'll listen before the message becomes urgent. Of all the organs, the heart is perhaps the most subtle in its early warnings. Long before we ever experience chest pain, shortness of breath, or a doctor's alarming words, the heart may already be struggling, quietly, patiently, and almost invisibly. This period, this silent beginning, is the window of opportunity. It's when we still have time to notice, time to act. One of the most surprising truths is that the first clues of heart trouble often appear not in medical scans or blood work, but on the surface, in the mirror, in our skin, nails, face, even in our ears. These aren't just folk tales or coincidences. These signs are being increasingly recognized and studied by cardiologists around the world. Yet many of us overlook them, blaming what we see on aging, stress, or the weather. A pale face is just fatigue. Swollen eyes are just a salty dinner. And yet, the body is waving a quiet flag. Heart failure rarely crashes in like a thunderstorm. Instead, it tiptoes, laying down clues like breadcrumbs. Changes that seem small, brittle nails, thinning hair, a subtle shadow under the eyes, may be the body's way of asking for attention. These aren't just cosmetic shifts. They can reflect serious changes in blood flow, oxygen delivery, and fluid balance. The outer changes are often mirrors of inner strain. What's powerful is that you don't have to be a doctor to notice them. All it takes is a shift in awareness, a willingness to look closely and ask, has something changed? You don't need special equipment. Just a mirror, a little curiosity, and the humility to take small symptoms seriously. This isn't about panic. It's about partnership with your own body and with those you care for. This story will guide you through 6 specific external signs that doctors pay close attention to when evaluating someone for possible heart failure. Each one might seem minor on its own, but together they can paint a telling picture. Think of it as learning a new language, the quiet language of the body, where nothing screams, but everything speaks. You deserve to know the signals. You deserve to respond with kindness, not fear. By tuning in, by noticing the whispers before they turn into cries, we can step in earlier, live fuller, and care deeper for ourselves and those we love. Let's begin by truly looking. Most people rarely pay close attention to their fingernails, let alone consider them a window into their heart's health. But the truth is, nails can quietly reveal early signs of circulatory problems, long before more obvious symptoms appear. When the heart begins to struggle, one of the first things to suffer is peripheral circulation. The fingers, being far from the heart, often show these effects first. One of the key changes to watch for is brittleness. Nails that once grew smoothly may begin to split easily, flake, or feel dry and fragile. This occurs because the nail matrix, sutiti, the tissue beneath the nail, receives less oxygen and fewer nutrients when blood flow is compromised. Without adequate nourishment, the nails become weak. You may also notice ridges running lengthwise along the nail, or that the natural sheen has dulled. In more pronounced cases, the nails may take on a curved shape, bending downward in a condition called clubbing. This change often indicates chronic low oxygen levels in the blood and is a classic red flag for heart or lung conditions. Additionally, a bluish or purplish tint at the base of the nails can appear, especially in cooler temperatures. This cyanotic coloring is a sign that your blood isn't carrying oxygen as efficiently as it should. Unfortunately, these signs are easy to dismiss. "I've just been working with my hands," or Maybe it's my diet, we tell ourselves. And while diet, manual labor, and aging all influence nail health, persistent or progressive changes, especially when they're new, deserve more attention. It's not about jumping to conclusions, it's about staying curious and open to what your body is telling you. A simple weekly habit can make a big difference. Take a photo of your nails in natural light. Compare these images over time. Are your nails changing in shape, color, or texture? Is one hand different from the other? These comparisons can provide early clues that even a doctor might find helpful. If you spot something unusual or new, especially alongside symptoms like fatigue or shortness of breath, make an appointment. Don't wait for pain. Don't wait for crisis. Remember, the heart doesn't always raise its voice. Sometimes it sends a quiet message through something as small as a fingernail. All we need to do is notice, to listen, and to act with care. Paying attention to these seemingly minor signs can be a quiet act of self-respect, and in some cases, an act that truly saves a life. For many, hair is just a part of appearance, a matter of grooming, style, or age. But, to a careful observer, it can also be a window into something much deeper: the overall health of the body, and more specifically, the condition of the heart. Changes in hair texture, thickness, or growth patterns are not just about aging or shampoo choice. Sometimes they're early signs that the body, especially the cardiovascular system, is under stress. When the heart begins to struggle, its ability to pump oxygen-rich blood throughout the body becomes compromised. The first areas to suffer are often those furthest from the center, like the scalp. Hair follicles are highly sensitive to blood supply. Even slight decreases in circulation can affect their ability to receive the nutrients and oxygen they need to support healthy hair growth. Over time, this can lead to increased hair shedding, dullness, thinning, or even patches of noticeable hair loss. It's tempting to blame these changes on external factors: new hair products, seasonal shifts, or perhaps a recent illness. And, indeed, all of those can play a role. But when the hair changes persist despite good care, when no amount of conditioner or treatment seems to restore its former health, it may be time to look inward. Cardiologists are increasingly aware of this connection and often take note when patients report sudden or unexplained hair thinning. The changes may be subtle at first: less volume at the crown, more strands on the pillow, or a brush that fills faster than before. Over time, the hair may feel drier, more brittle, or appear lifeless. These are not merely cosmetic inconveniences. They may be signs that the tiny vessels feeding the scalp are receiving less blood than they should. A warning that the heart is not functioning at full capacity. A simple way to track these changes is to use your hands. Run your fingers through your hair regularly. Has the texture changed? Does it feel thinner than last month? You can also take monthly photos of your hairline or scalp under the same lighting. If you begin to notice consistent decline, especially in combination with other subtle symptoms, like fatigue or swelling, consider speaking with your doctor. Hair doesn't lie. It reflects more than our age or our habits. In some cases, it reflects the quiet strain of a heart that's asking for help. And if we learn to read these signs, if we stop dismissing them as vanity or coincidence, we just might catch something vital in time. Every morning begins with a face in the mirror, familiar yet subtly changing. Most of us brush past it quickly, focused on the day ahead. But what if that quiet reflection is trying to tell us something? What if the puffiness around your eyes, the softness in your cheeks, or the heaviness of your jawline isn't just from last night's meal or poor sleep, but a deeper signal, one coming from the heart? When the heart begins to weaken, one of the first systems it affects is fluid. Regulation. A healthy heart keeps blood and fluids moving efficiently, but when it's overburdened or failing, it struggles. This struggle shows up as fluid retention, not always in the legs or feet, as commonly believed, but often in the face. And since we sleep lying down, overnight fluid tends to shift upward, accumulating in the soft tissues around the eyes, cheeks, and jaw. You might notice it slowly, a slightly puffier face upon waking, a sense of fullness or tightness under the skin, or comments from others. "You look tired today," or "rough night?" While it's easy to blame a salty dinner or a restless sleep, persistent or worsening facial swelling, especially in the mornings, can be an early clue that the heart is under stress. A practical habit is to take a photo of your face first thing, in the morning, and then another in the evening, under similar lighting. Compare them over several days or weeks. Is the puffiness consistent? Is it getting worse? Does it coincide with other symptoms like shortness of breath, fatigue, or an overall sense of heaviness? These visual cues, subtle though they may be, can offer important insight. Many people ignore these signs because they seem cosmetic or unimportant. But to a trained eye, and to someone attuned to their own body, they are meaningful. Doctors often recognize these patterns, especially when combined with other risk factors. The earlier they're identified, the sooner supportive care and lifestyle changes can begin. The face, after all, is more than expression. It is a mirror of what lies beneath. The morning puffiness is not just about sleep or salt. Sometimes it's a sign that your heart is working harder than it should, struggling quietly to maintain balance. So tomorrow, when you meet your own eyes in the mirror, take a moment longer. Look past the routine glance. Ask yourself, is this how I usually look? Am I feeling well rested? Or is something just different? The answers might not be loud, but they are there, waiting to be noticed, honored, and gently acted upon. The skin has its own language, quiet, visual, and deeply honest. While we may focus on wrinkles or dryness as signs of age, more significant clues often go unnoticed. Subtle changes in skin tone and texture can reflect what's happening inside the body, particularly in the heart. When circulation falters and oxygen levels drop, the skin often speaks up, not in words, but in color. A healthy heart sends well-oxygenated blood through the body, giving the skin a natural, warm hue. But when the heart begins to struggle, blood flow becomes less efficient. This can lead to a noticeable change in skin tone, particularly around the lips, eyelids, cheeks, and fingertips. The lips may turn slightly bluish or purple, especially in cold environments. The inner eyelids and nail beds may become unusually pale. The cheeks can take on a dull, grayish, or ashen look. While these signs may appear gradually, they are often the body's way of signaling that oxygen is not reaching the tissues as it should. You might not notice it at first. After all, lighting changes, fatigue varies, and moods shift. But over time, if your complexion seems consistently duller, if your lips lose their natural rosiness, or if your hands appear unusually pale or cold, it may be worth a closer look. These changes aren't just cosmetic. They can point to reduced cardiac output, the heart's ability to pump enough blood to meet the body's needs. One helpful practice is to examine yourself in natural light. Stand near a window in the morning and take a slow, honest look at your face and hands. Are your lips pink or purplish? Is the skin around your eyes unusually pale? Do your fingertips look healthy and warm, or are they cool and slightly discolored? These observations, though simple, can be powerful. Another small test. Gently pull down your lower eyelid and check the color of the inner lining. A healthy pink suggests good oxygenation. If it's pale or bluish, that may signal reduced blood flow. Of course, occasional color shifts can result from weather or fatigue, but persistent changes deserve attention. Doctors are trained to spot these signs quickly, but you don't have to wait for a clinic visit. By learning to see your skin not just as a surface, but as a storyteller, you gain access to early, valuable information about your cardiovascular health. The skin may not shout, but it certainly shows. Learning its language isn't fear-driven. It's wise, attentive, and deeply respectful of the life within. It may come as a surprise, but your earlobes, those small, soft curves of skin, can hold valuable clues about your heart's health. Over the years, doctors have noted a curious detail: a diagonal crease on the earlobe, often called Frank's sign, may be associated with an increased risk of cardiovascular disease. Though it might seem far-fetched at first glance, this sign has been the subject of numerous studies and is taken seriously by many physicians. The crease typically appears as a straight or slightly curved line running diagonally from the ear canal toward the lower edge of the earlobe. It doesn't hurt and it doesn't itch, which is why most people overlook it. Many assume it's from sleeping on one side or just another sign of aging. But when such a crease forms without clear external cause, and especially if it's deep or appears on both ears, it may signal changes in the blood vessels, not just in the ear, but throughout the body, including those supplying the heart. Connection lies in the body's network of blood vessels. As we age or develop conditions like high blood pressure or atherosclerosis, our vessels can lose elasticity and become narrowed. The tiny capillaries in the earlobes are no exception. A crease may form as a visible reflection of these internal vascular changes. While not every person with a diagonal earlobe crease has heart disease and not every heart patient has the crease, the correlation is strong enough that doctors consider it worth noting, especially when seen alongside other symptoms. Next, time you're in good light. Take a moment to examine your ears in the mirror. Is there a visible crease that wasn't there before? Has it deepened or appeared on both sides? It's also helpful to compare current photos with older ones. What's important is not to panic, but to pay attention. If you notice such changes, especially in combination with other subtle signs, like nail changes, facial puffiness, or fatigue, it may be time for a heart checkup. Many people feel awkward bringing up something as seemingly trivial as an earlobe at the doctor's office. But remember, medicine is often about the small things, the quiet hints that, when pieced together, tell a much bigger story. Your ears may not speak, but they might still be trying to say something. Learning to see the body with new eyes is not about fear, it's about care. And sometimes, the smallest places reveal the biggest truths. The mouth is a place where we expect to find signs of dental trouble, cavities, sensitivity, perhaps the occasional sore. But few people realize that this small, complex space can also offer early warnings about the health of the heart. Fact, changes in the gums, tongue, breath, and even how your mouth feels from day to day may reflect deeper issues, particularly those related to circulation and oxygen delivery. When the heart begins to struggle, it affects more than just energy or endurance. The reduced flow of oxygen-rich blood impacts tissues throughout the body, including those in the mouth. Gums, for instance, are especially sensitive. They may become swollen, unusually red or pale, or bleed easily during brushing or flossing. These symptoms can, of course, point to gum disease, but when they appear suddenly or worsen over time without a clear cause, they may suggest a problem beyond the mouth, potentially involving compromised blood flow from the heart. Another, subtle yet important signal is persistent bad breath or a sour taste that doesn't go away with regular hygiene. When the body isn't processing fluids well, waste products can accumulate, affecting the breath. Likewise, a tongue that looks unusually pale, coated, or dry may indicate that circulation is lacking in that area. Some people report their tongue feels smooth, almost as if the texture has changed. These symptoms are often dismissed or misattributed to digestive issues, but they can be connected to cardiovascular health. It's also worth noting that some people begin to notice a slight shift in their voice, or that their breath feels shallower or more strained when speaking. These sensations can stem from subtle fluid buildup in the lungs or changes in the soft tissues of the throat and mouth, common in early or moderate heart failure. Even if you're not gasping for air, these small shifts matter. The body often adjusts quietly to the heart's reduced performance, and the mouth can be one of the earliest places to notice that change. If you've observed unusual gum bleeding, a persistent coating on the tongue, strange breath odors, or a sense that your mouth just doesn't feel the same, don't ignore it. Speak with both your dentist and your primary doctor. Sometimes, a routine dental visit leads to the discovery of a larger health issue, one that's far easier to address early. Your mouth is more than a place for words and meals. It's a part of your circulatory story. Listening to it? Really, listening could help you catch a quiet whisper from your heart before it becomes something louder and more urgent.